use this word contain, that they had, they can no longer just be satisfied just, doing it in secret. Now they need to come out because, again, the stressors around them prove to be too great.
And I think this is the perfect segue into the topic of, what the real life consequences are of such situations. So I think one of the most prominent ones right now is the story of Leah Thomas, the swimmer who is a trans female who was born a male and was a professional swimmer, but now identifies as a female and was able to compete against women. So like I said, this is one of the most prominent stories right now, but there's likely thousands of these. And, even outside of professional sports, there's problems with, women's locker rooms and historically female spaces, and again, I'm choosing my words carefully, but invaded by biological males who could potentially physically harm and sadly have, in some cases, biological females. So this is a real life consequence of what's happening.
Yes, and once again, it goes back to what you said a minute ago. If you say you're not even allowed to question the motives of people making these claims, you are like really you're leaving your front door open with a giant neon sign saying nobody's home, right?
Yeah.
And so to pretend that that's not the case, once again, are we saying that everybody it has bad intentions if they
Of
claim
course
to be
not.
female and they're going female? No, of course not.
No.
And by the way, and you talked about female only spaces. The other one that you didn't mention was female prisons.
Yeah.
Okay,
Women's shelters
Canada,
too.
the state, and shelters, women's shelters. Yes, in
Yeah.
Canada, in the BC, a women's shelter. They stopped. It received government funding. I forget what percentage was from the government, and it was a few years ago. And because of a trans activist, this person helped stop the funding to a women's shelter because these are women who are violated, victimized, assaulted by men, and there was a biological man in the shelter who looked like a male, and they
Hmm.
didn't want that person there. And again, it stopped receiving government funding. So for one person, or however many people want to go there, in these tiny percentages, everybody else must suffer because
Yeah.
of that. And in the prisons. So I'll tell you right now, there are some trans females. So these are biological men who identify as women. There are some who, if you put them in a male prison, I could see that, yeah, this would be to their detriment. These are, biological males who've lived as a female for much of their life. They are the more effeminate type that we talked about earlier, like from the youngest of ages. They
Yeah.
believed they were a girl. And I could see them actually fitting into, the female prison quite well. I
Hmm.
could really see that. Right. And it's for those types of people who, presumably the laws or the policies, shouldn't say the laws, the policies were created. Right. And once again, without proper oversight, the people who are not that type, they say either free pass, I'm going to pretend to be a woman and go in, and we've seen this happen. And as soon as they were let out of prison, they went back to identifying as male, or there's a different type of male to female trans person that I'm going to talk about in a second, who, who let's just say that they are not the same as that effeminate little boy. Okay. And this is the biggest debate. And I think it's a great segue because I think that most of I can't say I know for fact because they haven't identified as such. So I'm not going to read their mind.
Yeah.
But from what I'm about to tell you, based on this taxonomy, I would say that the people who create the taxonomy and know about these things would argue that people like Leah Thomas, again, I'm not saying that this is the case for Leah Thomas, but Leah Thomas and others are a very different type of trans person, okay, than the one I just mentioned about the very effeminate, the one that could pass as female, even
Hmm.
without surgery, but especially with surgery. Okay, so if I may talk about that,
Of course.
that okay. So I would argue that one of the main reasons over the past almost 20 years that there has been so much, let's say, backlash against anybody questioning trans ideology or gender ideology is because of a taxonomy created by Dr. Ray Blanchard, who used to work at CAMH in Toronto, and then by one of his, I guess, former students, J. Michael Bailey, who wrote a book, The Man Who Would Be Queen. And that was, I want to say 2004. I could be off by a couple of years, 2003, 2004, but I believe it was the early 2000s that he came up with this book. And I will say it could have been written more tactfully. It was a bit blunt, and the words that were used to describe the trans people in the book. All right. I haven't spoken to Dr. Bailey numerous times. I have no doubt he had no ill intent. Okay. Knowing his background, knowing his relationship with these trans people that are in his book, he only had the best of intention. Okay. He wanted to, before he did the book, he would, he was mentoring some trans people. He would bring them into his class to introduce to his students so that they would realize, here is a trans person. This person's a human being. They have feelings and blah, blah, blah. And he had the person, show the transition, the stage of transition and so on. And so he did what anybody who's trying to reduce stigma knows to do, which is to expose people to the individuals in a healthy way. Just like in the early 1970s, I believe it was 72, where when they were trying to change the definition and the terminology of homosexuality in the DSM, where they had a whole bunch of gay people who came on stage in front of all these psychiatrists and psychologists saying, hey, I'm not crazy. I'm not an alien. I'm just a normal human being. I just happen to like, the people of the same sex, right? But again, it's that kind of exposure to show the human underneath this condition.
Yes.
And that's what he was doing. So he came out with this book called The Man Who Would Be Queen. And at first, a lot of trans people were happy because finally our story's being told. People will learn about us, that we're not just these, these characters in these movies, these horrible characters in movies. Okay. Like Buffalo Bill, it was good. But then there was this backlash because, again, like I said, the book could have been written better. And he talked about a topic that some of these people did not want to be revealed because and I'll explain why, I understand it, okay, but they did not want it to be revealed. So for 20 years, almost 20 years, they've been on this campaign to completely tarnish his reputation. And I said earlier, or I said in the previous, I guess in the earlier episode, that there are certain names that just saying their name, might as well just be saying Hitler, okay? And they've been so effective in making sure that everyone thinks that they're totally discredited, there's a transphobic quack, blah, blah. And they just make up all these stories. If I tell one story, just one of them, okay? Because I want people to understand how these things happen. If you look up J. Michael Bailey, one of the arguments against him is he's unethical because he violated, he basically committed an ethical violation as a clinical psychologist. Well, J. Michael Bailey, he got his degree in clinical psychology, but he never became a registered psychologist. So he's got the degree of clinical psychologist, but he teaches clinical psychology at the university, but he doesn't practice. So they were saying like he was practicing without a license and stuff like that. That's not what happened. I want people to understand how ridiculous this is. What he did was, and he talked about this on my own podcast with him years ago, all right? He said that he would write letters in support of these trans people. I think they were always, I'm pretty sure it was always male to female, okay? So he would write letters and he would say, I have a degree in clinical psychology. I've taught human sexuality for years. And he said, although I'm not a clinician, he said, I have more knowledge and experience than any other clinician in this area, or many clinicians in this area. I believe this person would be a good candidate for hormonal, I think, and or surgical procedures. He wrote letters in support of trans people being able to transition. And the very same people are turning around and going, he's this unethical monster. Okay, that's what they're using as the example of his
How
ethics
bizarre.
violation.
Yeah.
It's bizarre. And by the way, he didn't violate any ethics because since he's not registered as a psychologist, he wasn't actually, and he wasn't practicing. And he's upfront just saying, I'm just supporting them in their transitioning.
Yeah.
So this is the kind of propaganda that has so successfully made its way into the dialogue that people truly believe he's some kind of, transphobic monster. So let me just very quickly say about what he wrote that was so horrible. And it was based on, again, on Dr. Ray Blanchard's taxonomy of male to female transsexuals. Now, I'm going to say transsexuals because at the time, that's the terminology used. Today, many trans people will say, I'm transsexual. I'm not transgender. I'm transsexual. Okay, don't lump me in with these people who are just appropriating the term trans or misappropriating. Okay, they're saying I'm transsexual. So when I say it, I'm not saying it hatefully. I'm not saying it to denigrate them. I'm using the term that they would prefer. Okay, so it was male to female transsexual. So Blanchard was not the first person to recognize this. Harry Benjamin, I think in the 50s or 60s, wrote about it, and Magnus Hirschfeld in the, I guess, early 1900s knew about this as well, which is that, and this is only one issue, okay? That, again, in the old days, it was almost always male to female transsexuals. One of the biggest differences was some of these individuals were sexually attracted to men
Mm-hmm.
and some were sexually attracted to women. For someone to deny that that might be relevant in some way to considering somebody's experience as transgender or transsexual would be silly. Now, what they claim is gender identity and sexual orientation are totally, unrelated. So why would you try to conflate the two, right? You might try to claim that they're unrelated, but when they correlate and they map onto each other really clearly in most cases, we can't deny the connection. So again, just think about that. So there are this, again, we're going male to female transsexuals who are either interested in men or in women or in both. And some, are asexual. They're not interested in either. Okay. But the fact is most are one or the other. Now, just to help people, just a term that people should understand, I'm going to ask you, Malini. Well, let me ask you this question. Ready? Okay.
Okay.
So if I am a biological male and I'm married to my wife, who's a biological female, and now I say, no, I am a woman, and I
Mm-hmm.
transition into a woman, and I say, but I still like women. What does that make me? And what does it make my wife?
Well, and this is what we talked about before, where there's that underlying homophobia. So I would say that would make you lesbian, but I
Okay.
feel like there's
Mhm.
more to it than that.
And would that make my wife lesbian as well?
Technically, no, but I can see an argument made towards yes.
And this is where the discussion gets fraught with hostility and
Yeah.
so on, right? So I will tell you that most lesbians, at least every lesbian I've spoken to, I'm not going to speak for all, but the one I've spoken to, say, hell no, you're not going to call a biological male lesbian,
Hmm.
and you're not going to call a woman who was attracted to a biological man who just happened to, make his appearance or look like
Yeah.
a woman. You're not going to call her lesbian either. Okay, so this is where we have to try to think of all sides. So when trans people or trans activists and their allies say, how can you be a feminist or how can you be a woman if you deny that trans women are women and therefore they're
Hmm.
lesbians and so on,
Yeah.
right? You are completely negating the experiences and negating and denigrating the wishes of a large proportion of people in order to accommodate a tiny proportion. Where is the balance? And whether we're talking about, again, sports, women's spaces, okay, or even just the concepts, right? Trying to, it's a tough act. And again, for people who are trying to say, whoa, I'm not transphobic. Okay, I
Hmm.
got no game and no dog in the fight here. I'm just saying I'm watching people feel distress. I'm watching people feel that their voices are being muted. I'm watching, especially feminist, female feminists saying, once again, it's men telling us what we can do, and so on. I get all that. Sometimes the rhetoric gets hateful. Sometimes it gets hyperbolic. But the fact is, there are many, many people who are being hurt by this,
Well,
okay,
and that's the thing.
physically
We have
and
to
emotionally.
accept the realities of the situation, right? It's not about hurting people's feelings. It's not always about being politically correct. It's what is the reality of the situation. And speaking as a woman, um, going to the gym, I don't know how I'd feel, and I haven't run into the situation yet, but I don't know how I would feel if there was a biological man who identified as a female in the locker room. I can say I would probably feel a little bit unsafe. Not to suggest that all such people are going to, be violent or harmful. Um, and what I'll also say is that, I'm stronger physically than many women, but I'm not stronger than probably, a 6 foot tall biological male. I can deadlift all I want, but I'm not going to be able to. The science doesn't contribute to that making sense. I wouldn't be able to physically defend myself against somebody twice my size, for example. So
Right.
as I'm tiptoeing around my verbiage of this, I recognize that that could then be inferred as me being transphobic. But then I ask the question of why then in the first place are there separate female bathrooms, separate female locker rooms, and so on and so forth? I imagine that they were born out of, you know, safety, privacy, and many other things. What the solution is, I certainly don't know, because I know that there's some suggestion of trans bathrooms, but that would be fraught with many problems as well. But the fact remains is that, as you suggested, we are accommodating a very small percentage of people at the risk of putting a larger proportion of people in danger.
Right. And the remedies are sometimes, they would be laughable if it wasn't so ridiculous, which is just recently, I think it was this past week, there was a school, high school, pretty sure it was a high school. Okay. I don't want to get it wrong. It might be a college, but I thought it was a high school where the women were complaining that there was a biological male, had all his body parts intact. He was in the locker room and they felt uncomfortable with him watching them. Okay. And so the school, instead of addressing that, decided to shut down the lockers. Okay. Like they had some exceptions, like I think for the professional team or not, or the competitive teams, I think.
Yeah,
But they're basically saying, okay, fine, no one's going to use the change rooms.
right.
So, as opposed to making this person, maybe use an alternative change room. And other times when girls have said, look, I feel uncomfortable. And some of them have said, whether it's in a fraternity, whether it's in a change room, where this person is visibly erect. Okay, this person has an erection as they're watching us change. Now, I'm not there, so I can't say it's happening, but they're saying it's happened.
Mhm.
Again, why should we discredit their
If
lived
that's their
experiences?
experience, yeah, yeah,
Right? And so when they say that, they are being treated like they are the problem. Oh, you don't feel
yeah.
comfortable with this biological male in the change room? You can go into a different change
You
room.
bigot,
Versus
go
saying,
somewhere
what
else.
about this?
Yeah, yeah, yeah,
Right. Okay. So again, what are we talking about here? Well, and by the way, so many women say that I was sexually assaulted as a child or as an adult by a
yeah.
male. So I feel uncomfortable being in the most vulnerable space, like in a change room,
Sure.
with
Yeah.
a male, or having my child there, or she was assaulted. And people say, well, women assault women too, or girls too. Yes, they do. But statistically speaking, they're in the minority, right? And B, just because of the way that society has been, because I know there are some European countries where they have, families intermingling, whatever. But if that's how people were raised to have this, belief that this is how the space should be, once again, why are we going to have a wholesale shift in perspective to accommodate a tiny proportion? Now, once again, I hate that we have to keep giving these caveats. I'm not saying that every trans person who wants to use these spaces is doing it for a nefarious reason,
Of course
right?
not. No,
And I
no,
can
not at all.
understand. I can empathize with them. No, not I can empathize with a biological male who is presenting as female, who doesn't look sorry, who presents as female, especially if they really present, like if they pass as a
Sure.
female, feeling unsafe in a male
Absolutely. Yeah.
bathroom or change room. Yeah. So let's find accommodations that will help them, but that do not infringe on the rights of other people. And let's do it in a compassionate way, compassion for everybody. Because, like I said, when you hear the people try to negate the fears and the experiences of women who have been assaulted or who are afraid of being assaulted or know someone who's been assaulted, like it's so callous. So let me
Yeah.
talk about now, what are we talking about here as far as this distinction I started saying earlier? So, and then people can understand this, because this term is now coming up more and more in the last year. And I hear it used often hatefully. And so I can understand why, if anyone who identifies this way, or who will be identified, even if they don't identify, that other people go, you must be this condition, just completely, let's say, shit upon. Okay. So I'm not doing it in that way. I want to be very clear. Just because some people use it hatefully, I am not. The term is autogynephile or autogynephilia. This condition, people say, oh, it's something that nobody believes in anymore. Only these hateful transphobic dinosaurs still talk about it. There's no science behind it. There is a lot of science, and many autogynephiles say, wait, no. This is me. This does
Mm-hmm.
describe my condition or my experience. Don't deny my existence. For all the people who are saying don't deny the trans people's existence, why are you denying the existence of people who are saying, no, this is me? You don't believe me? Go onto YouTube, type in autogynephile, and you'll see many people talking, more and more people today talking about their experience. I had an autogynephile come onto my podcast, the very last podcast I did on my other channel, was an autogynephile who reached out to me. Okay. And I have numerous autogynephiles who correspond with me.
Yeah.
They don't know me personally, but they've seen me talk and they know that I'm compassionate. They know that I'm not trying to in any way denigrate them. And they say thank you. And they're sharing their experiences, right? They've told me their experiences and they say, yes, I'm autogynephilic. So don't pretend they don't exist. A number of years ago in the 80s, Ray Blanchard um, noticed, well, he basically started seeing that there were two types of male to female transsexuals. And one of them was the one who was attracted to men, and the other was mostly to women. And there can be bisexual and some asexual. Now, one thing is, I asked you earlier about if I'm a man and I transition into a woman and I like women, what does that make me?
Mm-hmm.
So, a way to avoid this, in a lot of the research as well, people are saying, well, what are they actually talking about? What is their attraction? Okay, when they ask about their orientation. So, there's a term that we use called androphiles and gynephiles. So, phile or philo meaning love. So, an androphile is somebody who's attracted to males, and a gynephile would be attracted to females. Okay, and then you can have bisexual, asexual, and they have different terms
Okay.
for those as well. But the point is, that way we don't have to worry about these other labels. We're just saying, what is the object of your sexual attraction? Okay, male or female or both, or neither. So in any event, the male to female transsexuals who are androphiles versus gynephiles, that was the big distinction, number one. Okay, who they're interested in sexually. But number two was, when did they first present their gender incongruence? And with the androphiles, the ones who are into men, the ones who just grow up to be gay if you let them, they were the ones who, and it's not 100%, I want to be clear here, but we're talking like 90 something percent correlation. Okay. Now, again, it's not perfect. It's not, and I want to be very clear here. I do believe, and I've said this to everyone I've spoken with, like on my podcast, all right, I do believe that there are some who are the autogynephiles, and there are some who, what Blanchard called the homosexual transsexuals.
Yeah.
And then I believe that there's an other type, a third type at least, who don't fit neatly into one or the other. And it's not the bisexuals or anything. It's just that they just don't fit neatly. So I want to be very clear here. All right. Because I know Blanchard and Bailey, they really they rigidly adhere to this taxonomy. All right. And they have good research to support it, but it's not 100%. So nobody should try to label me as saying, oh, I say it must be one or the other. There are other types, okay, or people fit in. Now, and I can't say for certain, but that's based on their self-reports, and I'm going to choose to believe it. Okay. So the point is this: the homosexual, transsexual, the androphile, they, from the youngest of ages, were very effeminate, very fair, slender, and they pass really easily, or much easier, as female. They even just having long hair. Whereas the autogynephiles, or the gynephiles, they went through childhood like a typical boy, and they're usually on the more masculine side. And when we talk about masculine side or masculine brains, and not everyone likes this terminology, I'm just using what other people have said, okay, is that they talk about, let's say, for example, either someone who's really rugged, okay, like, hyper masculine, or, and we talked before about like ADHD has like neurodivergence. Maybe they have ADHD or autism. Some
Mm-hmm.
people have defined autism as like a hyper masculine brain disorder, very logical, rigid, or logical, and so on. So I'm just using the terminology. I'm not saying it's great science, but I'm just saying that they have hyper masculinized brains, it seems, or hyper masculinized behaviors. Again, either as jocks or as engineers, as computer nerds, as IT people, right? That they have that type of
Yeah.
that kind of thinking. That's more on the male side than the female. So when the homosexual transsexual goes through puberty and their sexuality starts to they're acting more, or they're feeling more of the sexual attraction and so on, they like boys. When the autogynephiles are going through it, they still like girls. But here's where the big change happens. Many, if not most, actually I'll say most, statistically speaking, most. Okay. Now Blanchard and Bailey would say all, I think, or almost all. I'm going to say most. During their sexual development, the autogynephiles, they started to get turned on by wearing female lingerie or women's clothes, whether it was a sister, a mom, or a girlfriend. And if that's all that they did, then you might call them a transvestite. Okay, if they got sexual pleasure from wearing the clothes or the underwear. But they eventually develop beyond just the clothing, where they start getting aroused sexually to the idea of being a woman themselves. They, whether it's having the body parts basically. And that's their, what we call a paraphilia or fetish, that they get turned on not by women's clothing per se, but the idea of being a woman. Whereas the homosexual transsexuals, now there are a few who would say that, yes, they get turned on by that idea as well. Okay. But the majority of them, when they have these questionnaires for autogynephilia, okay, the homosexual transsexuals, the majority, not all, but the majority, they score lower on that than the autogynephiles, right? Because they're not so much turned on about the idea of having the body parts and whatever, but they want to be a woman, but they don't get the sexual arousal from it.
Mm-hmm.
Okay. Now it's curious because there are people who try to debunk this, and they say if you ask a woman the same questions, they will also show these supposed signs of autogynephilia. Okay, that they get aroused by having body parts and so on. But the questioning is done in such a way that it's rigged. I don't know if it's done intentionally, but it's not an exact replica of the autogynephile question. So they're worded in ways that, yes, many women would say yes. Okay, I get turned on by these things. But there's a big difference. Well, anyway, there's a big difference between the woman, according to the experts, between the woman's experience of supposed autogynephilia, okay, and an autogynephile, okay. So the point is, so these men in their teens, starting in their teens, they're getting aroused to this thought of, again, having a female body. And some people don't like this term. It's called erotic target location error, ETLE. So I understand that people get rankled by the terminology. I'm just saying this is the terminology that is used.
Right.
I'm not using it in any negative way. Okay. So an erotic target location error. So what they're saying is, for these autogynephiles, they have an erotic target location error. And by the way, if you're turned on by, let's say, high heels or by rubber or leather, okay, then they would, and I don't just mean turned on, but like they can't get aroused without that.
Right.
That would be an erotic target location error. Instead of being, or by feet or whatever, instead of being turned on by the usual erogenous zones, you need to have these other body parts or objects present in order to be aroused. Okay, so that's what they call the error. So with the autogynephilia, the theory is that their error is, instead of being turned on by a woman's body parts, you get turned on by thinking, instead of being turned on by imagining being in those body parts. Okay, it's those body parts being inside you. Okay, that's the theory of autogynephilia. And I can't speak for everybody, but the people with whom I've spoken who acknowledge their autogynephilia, they seem, reasonably, no more or less than other people, reasonably healthy. Okay, psychologically speaking, they accept. It just seems that they accept, like, yeah, I have a paraphilia or a fetish. Okay. And, yes, they have gender dysphoria. Yes, they go through this whole thing. But as far as their psychology and their mentality and so on, they just seem okay. Whereas other people who deny, and again, sorry, I shouldn't say deny, who say that they're not autogynephilic. I can't say if they are or not. Okay. Because they're saying that they're not. But for many of them who say I am not autogynephilic, but they look to have all the signs of autogynephilia,
Right.
they are the ones who seem to be in distress or to have, like psychological, let's say, issues beyond just the gender dysphoria. It seems because, like, they're either denying reality or, not accepting a part of who they are, right? And this is even somebody, let's say, who's gay and they've denied it their entire lives, whether they're 20 years old or 60 years old, to feel so shameful, to feel that I can't be who I am because I'm afraid that either God, if you believe in that, or my family or society or my friends or loved ones will reject me. To believe that that's who you are and that's what, that you can't live your life in line with who you really are. I've seen it. I've seen the toll it takes on people, right? It affects your psychological functioning. I get it. I have empathy, only empathy for that. So I think that the autogynephiles who can't acknowledge it, who are lying to themselves, I feel that from what I've seen, that it has a negative impact on their psychological well-being beyond the gender dysphoria. Okay. And by the way, I can understand why they would not want to be, let's say, to be reduced simply to their sexual, desires, okay, to their paraphilia. I can understand why they would rather say, no, I was born in the wrong body, right? I'm really a woman in a male's body, rather than saying I have a fetish, I have a paraphilia. Okay, I can understand that personally, but I can also understand that strategically, because people are far more likely to say, yes, let this person, let's say, share spaces with females, because from the youngest of ages, they'll say she, like she always thought she was a girl. From the youngest of ages, this is just who they are, psychologically or
But
spiritually,
this
whatever you
is a
want to call it.
this is a large part of the problem as a whole, is that people are being boiled down to their gender and sexuality. Period. That's it. Those are the two, highest ranking facets of identity and who we are. And if you deny that in any way whatsoever, you're a bigot, you're a homophobe, you're a transphobe, so on and so on and so forth. Um,
Right.
that's wrong. It's patently false. And we started talking about this and the different types of presentation and paraphilia and so on because of the problems that are arising with, again, women's spaces and the I guess disagreement between some feminists and other women as far as what is appropriate. Is it anti-feminist to deny that trans women should be allowed in these spaces, or from a safety standpoint, is it just prudent?
Right. And again, if you see that these are biological males who still have a sexual attraction to females,
Yeah,
that's very different than if you say, okay, you know what, I'm not comfortable with this male being in the change room, but for everything I know, he's not even interested in me, right? Like he's interested
yeah,
in females. They'll feel
yeah,
more comfortable, especially if they don't see him getting physiologically aroused in their presence. Now, little side note here, just because again, I'm always mindful of language. There will be people who say, but wait, if a male is going to assault a female, it's not about the sex. It's more about power, control, and so on. Yes, in many cases, sexual assault is that. It's beyond the sexual part of it. But the reality is, it's not just that. Like you can't exclude it from the equation.
no,
And for many people who do assault, it may be about power, control, dominance, hate, misogyny, whatever. But there's also a sexual component to it. So if you think that the person is not sexually attracted at all to women, you might feel more comfortable, whether realistically or psychologically.
yeah.
So
But the
there is a
fact is
difference.
there's no way for us to discern that, right? When it comes to the pragmatic aspects of, okay, well, what does
Right.
society do about this problem? That, there's no way to determine that.
Exactly. And that's why people are saying, so what are we going to do? Are we going to have them fill out a survey before they go into the space? Okay. Are we going to have them
Yeah,
examine their genitals to see if if they've been transitioned
right.
yet medically? Right. So again, these are complicated, and complicating factors and complex factors that we need to take into consideration. But if by just asking the questions, if by simply saying, but wait, what about all these
Yeah.
proven known cases where biological men have taken advantage,
Hmm.
whether they believe they're trans or not, they have violated women in these spaces. To not be able to talk about that and say, oh, how do we balance the risk? That's not doing anybody any good. But that's what's happening. People are afraid to talk about it because they're going to be called a bigot, transphobe, etc.
Yeah.
So back to the autogynephiles, if I could say just for a second,
Hmm.
the final few points about it, just because I'd be remiss if I don't, mention these differences. The other difference is that the homosexual transsexuals would usually come out much younger in life, okay, late adolescence, early 20s, whereas the autogynephiles, they were able to contain their paraphilia. They're able to, wear, let's say, women's lingerie underneath their clothes. All right, whether it's every day or certain days, and they could maintain it for quite some time. Yeah, they still were somewhat dysphoric, but they're able to contain it enough that they could function reasonably well. Not all, but many. Then later in life, usually it was traditionally like in their 40s and 50s, when a major life crisis would happen. Maybe you get fired, get divorced, okay, lose a parent. When the external stressors got too great, and we know that stress triggers virtually anything medically, psychologically, physically, right?
Hmm.
That was kind of the thing that pushed them over the edge, and they can no longer contain their paraphilia, and they had to, express it more. Okay, and that's the whole thing. I keep using this word "contain." That they had, they can no longer just be satisfied just, doing it in secret. Now they need to come out because again, the stressors around them proved to be too great, and that was the narrative of many of these autogynephiles that they came out much later. And again, they are so stereotypically male that many of them have jobs as firefighters. I'll say it again: firefighters, truck drivers, paramedics, war veterans.
Yeah.
Or again, the other side, the tech on the technical side, engineers,
Mhm.
tech, and so on. And Bailey wrote in his book, "The Man Who Would Be Queen." I'm going to paraphrase him, but he basically said, if you put 100 male to female transsexuals in the room, he said, I would be surprised if Blanchard and I disagreed, and like in the taxonomy or the classification, disagreed on any more than two of them. Okay, because he feels it's just so obvious. The etymology, the presentation, the needs, the desires, the sexual, the sexuality of these two types are so distinct that to treat them as the same is ridiculous. And here's the thing: here's the other conflation, and I think it's so important for people to understand. Whenever autogynephiles, okay, or people who are who I'm going to say either autogynephiles or seeming autogynephiles. They're not the homosexual transsexuals. They're definitely gynephiles. They like women. Okay. Whenever they're saying, it's not about a paraphilia. How dare you say that? We were born this way. Okay.
Mhm.
We were from the youngest of ages. We knew that we were female. Do you know who they point out to prove their case?
No.
They point out to the homosexual transsexuals. Okay. Because those are the ones that you look at their history and you can see from the youngest of ages, they were effeminate. They did want to wear a tiara and stuff like that. The autogynephiles, they weren't like that because they
Mhm.
were typical males. They were hypermasculine males in most cases. And sometimes they might show a picture. I think Caitlyn Jenner did this and I'm not going to say anything about Caitlyn Jenner, but if you think about, masculinity, as Bruce Jenner, Caitlyn
Yeah.
won, I think it was 72 or 76 Olympics, the decathlon. Okay, in the male category. So, that most people consider that to be, the masculine. Now, Bruce Jenner as Bruce wasn't presenting like, macho or anything like that, but athletically, he
Mhm.
was the prime specimen. He won the damn decathlon in the
Yeah.
Olympics. Okay.
Yeah.
So Caitlyn Jenner, when she gave her talk, I think it was 60 Minutes or whatever, a few years ago, I think either she talked about or she showed one picture of her wearing a dress as a little boy
Mhm.
and saying, that shows that she was always, again, a girl trapped in a boy's body. But the reality is, many boys who are completely straight, right, and not transgender in any way. By straight, I mean the sexuality or sexual orientation. By transgender, I mean the gender identity. In neither way, they're neither. But they wore dress. They played up.
Mhm.
Okay, they like to take on this role or whatever, whether it's to be mommy because they're identifying with mommy or something like that. So to do it periodically
Yeah.
is nothing like somebody who's doing it every day and saying that they want to be a girl.
Yeah. The
So
context
again,
matters.
context, the persistence of it, and so on, it all matters. You can't just say, "Well, here's evidence." Okay,
Yeah.
that's just again, it's self-serving distortion of reality. So and speaking of which, I want to say one more thing because, or a few more things about autogynephilia, because again, it's the most controversial. It produces the most vitriol. It produces the most shutting down of discussion. All right. And again, nothing I'm saying is to denigrate autogynephiles in any way. And anyone who knows me knows that. And I've lectured
Mhm.
about this so many times. Here's the thing. Getting back to that, and now I'm blanking on it. My gosh, with the paraphilia. Oh yes. So here's what people say, whether it's the autogynephiles or just trans activists themselves. They say, "Isn't it convenient?" These dinosaurs, these transphobic dinosaurs like Bailey and Blanchard, what they say is, either you're homosexual, transsexual, or you're autogynephile. And if you deny being an autogynephile, then you are a liar. Okay, that's what they say. They claim that if they say, "Well, no, you're not. You're not. We know you're autogynephilic, but you're denying it. You must be a liar." Remember, I'm saying if they deny it, I'm going to say, "Fine, you belong to a different category."
Yeah.
Right? I'm not going to deny your experience. But the reason Blanchard and Bailey say that is studies have shown, and Blanchard published these studies, that among autogynephiles, up to 50%, if I'm wrong on the number, I apologize. There may be a higher number, but I know in at least one study, it was 50% of men who said they were transgender, they're male to female transsexuals, they were asked about, if they ever enjoyed cross-dressing, if they ever, again, got off on that. And up to half who denied it, either a family member when interviewed said, no, as a kid, as a teen, I caught him, let's say masturbating in his mom's underwear or something like that. Okay. So either, despite denying it, other people said, no, we saw it. Okay. Or their current partners say, yes, he sometimes wears my lingerie and I've seen him, stuff like that. Okay. So, or third, in one of these studies, at least one, I think there's more, a certain percentage, I want to say 1/3, I could be off, but a certain percentage of the people in the study, they were at the clinic from where they were recruited for cross-dressing.
Mm,
Okay, they came because of cross-dressing issues, and yet on the survey they denied ever cross-dressing.
right.
Like, so this is why they're saying that they deny, if they deny the whole cross-dressing fantasies and arousal. It's not they're just making it up; they're basing it on research. Okay, so I just want to be clear on that. So I don't know if I covered everything about the autogynephilia. Yeah, I guess the only other thing is, like I said earlier, I understand. I want to say it so many times. I can understand if I were autogynephilic. Okay, like I said, I don't want to be just reduced down to my fetish or paraphilia. And if I look like a man biologically, okay, I've got the stature, I've got the face, the jaw structure, and everything like a man, and I see a bunch of other male to female transsexuals who pass as women, no surgery, nothing. They just they let their hair grow out. They really look feminine. I can understand why that would make someone who's either autogynephilic or
Mm-hmm.
not homosexual transsexual. I can understand why they would have a lot of resentment, hurt, distress over knowing that some people really pass well. Because for someone who's transgender, that's one of the biggest issues, is wanting to be able to pass, to live life like the other sex. So I
Mm-hmm.
say all of this with empathy. But while saying with empathy, I'm also saying, please, whether it's someone who's autogynephilic or someone who thinks they're doing right by trans people, let's not deny that there is a wealth of evidence to suggest that not all trans people are the same. And the final point I'm going to say about this, if you want to see the best document, and we'll post it, we'll put the links on the web on the YouTube channel or wherever else on our website. If you want to see the best description of autogynephilia, take it from Dr. Anne Lawrence. Dr. Anne Lawrence in 2000, I want to say 13, I could be off by, I think it was 2013, wrote a paper called Becoming What We Love. And then in 2017, wrote a follow-up paper on autogynephilia and homosexual, transsexual, the typology or taxonomy, Blanchard's taxonomy. And she wrote about this in the most, comprehensive, empathy-evoking, and descriptive manner that you could imagine. And sorry to Dr. Blanchard and Bailey, but I think she did a better job than them. And here's the kicker. She's autogynephilic herself. Okay? So she, and in her paper, she basically explains autogynephilia in ways that negate all the haters, okay, claims against it. Well, what about this? What about this? What about that? She describes ways to explain. Now, does it make it 100% certain? No, I can't say that. But when you look at how she describes autogynephilia and the conceptualization, that's why she says becoming what we love. Instead of reducing it to the sexual attraction, she's talking about self-love, about loving yourself
Mm-hmm.
in this other identity, and loving different parts of yourself and everything. The way she describes it, like I said, I think it captures everybody who is not the homosexual transsexual. I think it does a beautiful job. So if anyone wants to educate yourselves, please read it. And again, anyone who hears me talking about this or hears us talking about this, to think that this is in any way anti-trans or
Mm-hmm.
anti-autogynephilic, I don't know what you're watching. And I hate to have to put these caveats out there, but
Yeah.
people are going to take this and they're going to try to find a way to try to silence us by saying we're saying something that's wrong or
Yeah.
hateful. It's not.
Yeah. Where the reality is we are thinking critically as we do and looking at all sides as critically as we can. Because the fact is that there are real implications of this in our world. We'll continue this conversation in the final part of this episode. Please join us next week on Awake at the Wheel.